Malaria: causes, symptoms, diagnosis, treatment and prevention. Malaria is a serious disease that spreads when you're bitten by a mosquito infected by tiny parasites. When it bites, the mosquito injects malaria parasites into your bloodstream. Malaria is caused by the parasites, not by a virus or by a type of bacterium. If it isn't treated, malaria can cause severe health problems such as seizures, brain damage, trouble breathing, organ failure and death. If you're traveling to an area where malaria is common, talk to your healthcare provider about ways you can prevent being infected. Malaria is common in tropical areas where it's hot and humid. The majority of these cases occur in Africa and South Asia. Malaria occurs all over the world and happens most often in developing countries and areas with warm temperatures and high humidity, including Africa. Anyone can get malaria, but people who live in Africa have a higher risk of infection than others. Young children, older people and those who are pregnant have an increased risk of dying from malaria. People who live in poverty and don't have access to health care are more likely to have complications from the disease. More than 90% of malaria deaths occur in Africa, and nearly all of the people who die are young children. More than 80% of malaria deaths in the region in 2020 involved children under the age of 5 years old. When that mosquito bites someone else, it transfers a parasite to the other person's bloodstream. There are 5 types of malaria parasites that can infect humans. In rare cases, people who are pregnant and who have malaria can transfer the disease to their children before or during birth. As malaria gets worse, it can cause anemia and jaundice, yellowing of the skin and whites of the eyes. Malaria symptoms usually appear 10 days to 1 month after the person was infected. Depending on the type of parasite, symptoms can be mild. Some people don't feel sick for up to a year after the mosquito bite. Parasites can sometimes live in the body for several years without causing symptoms. Some types of malaria, depending on the type of parasite, can occur again. The parasites are inactive in your liver and then are released into your bloodstream after years. The symptoms begin again when the parasites begin circulating. Your healthcare provider will examine you and ask about your symptoms and travel history. It's important to share information about the countries you've visited recently so that your provider can clearly understand your risk. Your provider will take a sample of your blood and send it to a lab to see if you have malaria parasites. The blood test will tell your provider if you have malaria and will also identify the type of parasite that's causing your symptoms. It's important to start treating malaria as soon as possible. Your provider will prescribe medications to kill the malaria parasite. Some parasites are resistant to malaria drugs. The type of parasite will determine what type of medication you take and how long you take it. There are parasites that are resistant to this medication. Anti-malarial drugs can cause side effects. Be sure to tell your provider about other medicines you're taking, since anti-malarial drugs can interfere with them. Depending on the medication, side effects may include gastrointestinal, GI, issues such as nausea and diarrhea. If you plan on living temporarily and or traveling to an area where malaria is common, talk to your provider about taking medications to prevent malaria. These drugs can't be used for treatment if you do develop malaria despite taking them. To lower your chances of getting malaria, you should apply mosquito repellent with DEET, diethyltoluamide, to exposed skin. The RTS-SASO1 vaccine is effective against Plasmodium falciparum malaria, which causes severe disease in children. If malaria isn't treated properly, it can cause serious health problems, including permanent organ damage and death. It's essential to seek treatment right away if you think you have malaria or have visited an area where it is common. Treatment is much more effective when it's started early. The right medication and correct dose can treat malaria and clear the infection from your body. If you've had malaria before, you can get it again if an infected mosquito bites you. If you've traveled to or live in a country where malaria is common and you have symptoms of malaria, see your provider immediately. It's also important to seek treatment right away to stop malaria from spreading to others.